What the PLAB2 exam is talking exam. It's a consultation exam, ethically sound, the same like MLA would be same. They want to know that you're a safe doctor and deliver information to how you deliver information to the patient. Don't think much about that. And this is what is PLAB2 or MLA would be, with few of the changes. That's so right, for now, it's again, it's 16 stations. Yeah, and 2 rest stations. The format is the same. Nothing's changed with the format. It's still 16 stations. It's still 2 rest stations for a total of 18, a duration of 3 hours. And your reporting times and end times are there. If you're morning, 8:45 is your report, and you leave by 12:30. For the other reporting time, it is going to be 11 a.m. for an end time of 6:30. Yeah, exactly. So we're just moving a bit faster because we need to complete a few more things about that. So if Dr. Sarah is here, can you please open your mic, because we can't see because members are a lot of here. If Dr. Sarah is attending, please open your mic and speak. If not, then it's okay. So the format is OSCE, 3 people in each room, you, patient examiner. The marking system is known as borderline regression. So what is borderline regression? Well, borderline regression means the candidates themselves set the pass mark. That's right. Everybody taking the exam on this day will have contributed to the total pass mark. Let me ask you, everybody's doing good. Let me ask you. Yeah. Out of 16th station, if somebody passed 10th station, will he pass PLAB2? Yes. Oh. Am I right? You guys tell me, if somebody is going to pass 10th station, will he pass PLAB2? No. Not always. Not always. Not always. You still need to get that total score. So this is called borderline regression. They will set a criteria in that particular day. They will set a score that 102, 103, or 10 would be passing score, depending how they performed, competition level. That's right. And you might need to pass 9 stations sometime, or sometimes 10 stations. 9 stations only if remove one. Otherwise, 10 station, keep in mind, 10 stations. That's right. And you have to get high score. So I would recommend you prepare well for every station and try to hit 4 station, scoring 12 up to 12 as well. It'd be nice to know people's exam dates in the chat if you want to write down. Yes, guys, write down your exam date down so that we'll get to know that who is transitioning towards MLA. Yeah. And we are here to help. Here to help. Yes. 28th of June, Misbah. Okay, we got you covered. Misbah, don't worry about that. We'll keep updating. Join our group, UK Pass Academy. We don't say join our academy. If you want to, you do. Yeah. Okay. Yeah. So 8-minute station. Yes, 8 June. We have seen a lot of. Got a lot of Juners, huh? Yes, definitely. June, July. Don't worry about anything, guys. We are here to help. Definitely, we are on it. So I want to say one more thing about practice makes perfect. Now, in the beginning, it's very important to be exposed to 2 things. Okay, 2 things that you need to be exposed to. You need to see how a PLAB2 station in 8 minutes looks like. And the other part is that you need to do one more thing, which is see how patients simulate. Okay, both of those things we have for you. So in the course itself, we will be talking about the general approach to stations. But then on top of that, what we're going to be talking about is how a simulator simulates. And we'll show you, because we will be the ones simulating, and how a doctor should manage his time or her time in the 8 minutes that have been given. Yes. This is the true task. And then when you have this guidance from obviously the classes and the tutoring, you then go and practice every single day. Yes, I want to add on something. Yeah. So the gap which we found Radwan and me, that most of the time the student don't see that how to deliver information. So we started this part. We have implemented in our master classes as well, where the guest doctors who work in NHS come and we set 8-minute timer. I want to tell, it's not easy to do the consultation in 8-minute time. So following the data gathering part, management part, and seeing that as a observer or as debriefing that as examiner, you'll get to know that how to deliver that information. And it's quite like get well results about that, and a lot of people enjoying it, and the people able to do good simulation. It's like how the baby learn when see the new environment. The UK is a new environment for you, and if you want to learn that culture, you might need to see if how is doing. I want to tell 2 more resources before I forget. A GP behind closed doors. I can write it for you. And 24-hour A&E. GP behind closed doors. If you are in your country at the moment, GP behind. Thank you, Salwa, for posting the website and the WhatsApp link. Thank you, Salva, very much. Salva is one of the teacher here.
Yeah.
And the other one is 24-hour A&E, 24-hour in A&E, 24-hour
A&E.
Hour in A&E. You can see on the Netflix A&E and the GP behind closed door. Fewer episodes on the YouTube.
Not A&E, A&E.
A&E. So usually they call it A&E like this symbol. If you find it, every N-E, you can, yes, A&E. Right. So, well done. So guys, any question up till now? We are all hearing, so ask so that move further.
Yeah, we have a few more pieces of information to give you that will help you prepare. You need to know how you're going to be assessed. We're just going to go through some of these things. At any time, if you've got questions, please feel free to type it up. Other than that, remember, we have a WhatsApp group, we have a website, and you can contact me, Dr. Radwan Ali, or Dr. Zeeshan on the
ukpassacademy.com. So you can have that website. Thank you very much, Salva. So let's move to the next slide because the next content is very important. So distribution of scenarios. They want to see you as an all-rounder. All-rounder mean that you know everything, how to do as a good in hospital setting, every setting, GP setting, in a clinic setting, in an A&E setting, in a gynae setting, in OBS. So mannequins, they will, because they want you to show your skills on the mannequins. So we will get those mannequins. You will practice on that. Then teaching skills, talking mannequin, history taking, telephone. Because what do you say about telephonic consultation? Because
you need to be safe over the phone. You need to make sure that you can maintain the confidentiality over the phone.
Yes.
And by making sure that you, number one, check the
detailed ID. You're speaking to the right person, and they want you to do the consultation because they, you know, that in NHS the waiting time is already very high. If you speak to someone on the phone and you done the consultation well and you assess the well, and you don't need to ask him to come in the hospital, but another way around, you might need to ask the patient to come to hospital.
So what are the major mistakes during video or audio call stations?
Can you please, major mistake? Yes, thank you, Ms. for bringing up that. Quickly tell me that the major mistake, not checking ID, not checking time, that is right time to talk. Number two, the major mistake is that you still rush on that and your tone is very rude and you are not good at speaking someone.
So you're no longer face to face. If active listening was like this, okay, I see. Then on the phone, it has to be, okay, right? You have to actually verbally say it.
More practice is required. It's like a customer service. If you're going to call 3, hello, welcome to 3. So like this, your tone should be like
you have to chunk and check understanding more frequently. If you are speaking sentences, make sure you don't speak too many sentences without checking that they are actually understanding. So I think these are important areas.
And examination wise, there are a few examinations which might not be on mannequin, but don't worry, but mostly those are on mannequins, like abdominal examination, starting from head to toe, ear examination, eye examination, tummy examination, pregnant tummy examination, PV examination, testicular examination, and leg examination as well.
We love examinations here at UK Pass. We will be having mannequins and we will be having a talking mannequin to show you guys how it's all done live and recorded.
So we will do it, workshops we are introducing. We'll come to that point. Because the purpose of this is not advertisement. This is what we want. We want them to help them, because we not propagate to join any of the academy, but we propagating people to practice well. So I will tell you, there is a good news from UK Pass Academy where we are asking anyone to come in academy to practice, and we will be offering them to come into the academy without taking our full course. So I'll come to that, but first, for now, let's discuss what it is. So telephonic consultation, we already covered everything. We don't need to talk. Video consultation, same thing. Then how to do examination in the telephone. You just need to make sure that patient is coming to the hospital or not. You need to assess that. History taking station.
History taking is what you always knew. It's about finding the problem and it's about finding the diagnosis. What we're trying to talk about now for history taking stations actually is how it goes. So usually you're going to take your focused history. You're going to do the psychosocial history, which includes, who do you live with? It includes smoking, drinking, etc. It includes anything like stresses in life and things like that. You'll then explain the examinations that you'd like to do. And this here, when you explain the examinations that you'd like to do, is where you would try to approach the patient as if you're going to do the examination and let the examiner stop you.
Yes.
Which is then where you will find the patient or the examiner will hand you a clipboard or a
Yes.
paper, or will verbally give you the findings.
Yeah.
So
that could be done by practice when they will do practice. So for the history taking scenarios, you will get to know according to age, male history, sexual history, like any of the sensitive history you might be able to, you will be discuss those approach when you'll start taking part in practicing part. Combined session, you will take history, you go examine the patient and come back and
person
do the
mannequin
management. It's a tough one. It's a tough call. It would
you got to manage your time. I think that's
Yes.
the main thing I want you guys
Yes.
to know about that. Manage your time effectively. Your history taking should not be too long.
Yes.
You should take a very focused history
Yes.
and be able to then find the time to complete your examination.
Yes.
When you're doing your examination, do not waste your time with unnecessary parts like inspection, because really and truly, you're being assessed on the practical skill itself that you're actually doing the examination. Yeah.
Yes. So again, the most of the people want to know about what is SIM, what is talking mannequin. It's just like you would see as like a dummy with different sounds of lungs, and there would be a speaker fitted with another. Someone will be talking to the. You'll see the A&E setting, and it is all about practice. You will practice it. You'll get to know that different sounds on the lungs, different sounds on the ear, on the heart part, and different things would be simulated. It seems like real patient, but with practice, you will get to able to do that. We got here Simman with different heart sounds, like different lung sound, and you're able to practice here in the UK Pass Academy. So procedures, usually they are giving the venipunctures or different procedure, ABGs and IV cannulation. You will practice it and you'll perform according to the guidelines, or you should be doing it, because I know in different countries we perform in different way, but we follow the guidelines here. Okay, so teaching scenarios, they want you to be all-rounder. So the teaching scenario, they can give you anything. They are adding up things, different thing, like urine dip, they are adding 2-week pathways, they're adding, keep adding. They can ask you to do any of the teaching. Like they want to see your teaching skills. Prescription is a different thing. So what would be the prescription?
I mean, prescriptions are about writing, isn't it, guys? You got to write, and you got to make sure that you use the right color pen, that your handwriting is legible, understandable, that obviously you're making use of the BNF and managing your time as well. Okay. And so you do generally want to know your doses. Yes. But that doesn't mean you won't open the BNF.
So basically, I would say in the prescription, they want to see that how safe doctor you are. Will you able to use BNF in a good way or not? They want to see you that you open the right page. They want you to know the functionality of the BNF. If you are going to work in the NHS, BNF would be your friend. They want you to introduce you to the British formulary of national formulary of the drugs. So
that's this is right. One more thing about opening the BNF that you need to be careful about. Sometimes know that your prescription scenarios will be divided into a main task, which is to prescribe the main medication, and auxiliary tasks, which is usually to also prescribe the patient's regular medication. In these situations, what I need you guys to do is understand that the BNF mainly is to open the main medication. So if I've got an antibiotic to prescribe, and at the same time, the patient is on amlodipine and is on a statin, again, I don't need to open the BNF for statins and amlodipine. That will waste my time and I won't have time to finish. What you do need to open the BNF for, to show that you're a safe doctor, for the most part, is the main part, maybe the antibiotic, etc. So manage your time effectively there as well. Yes.
So marking system, already we told, is history taking. We call data gathering. They would assess you how short questions, how questions you are going to ask, and how will you manage your time. In the clinical management part, they will see that how you are going to explain the findings. The finding is most important part, and how you do as a whole using your personal interpersonal skills, cover how the candidate approaches the station, whether they establish rapport, how they use open and close-ended questions involving the patient in their care, and how they demonstrate professionalism and understanding ethical principles. So this would be about the marking systems, and you'll practice it when you will be debriefing yourself or your doing that. So how to prepare? Again, that's a good question. Again,
yes, practice makes perfect.
Yes,
definitely.
So it's about effective delivery, how you're going to do. Again, like a doctor, very kind doctor with a polite tone, everything they are going to see. And it's not about English accent or anything. This is about that how you're delivering and communicating. and
Yeah.
according to the right approach. Be able to maneuver a consultation with signposting that you're going to tell. For example, you're going to ask someone, you're going to intervene in someone's personal life, you're going to take sexual history, you need to signpost it. That there are a few questions about your sexual health.
Yeah.
Standard questions we usually ask to everyone with a similar complaint. Rapport building, be yourself, and you have to always be smiling. Apart from breaking bad news, in every station you'll be smiling under stress, whatever is going on. This is what it happened. Again, different scenario, you're going to say the similar scenario, the UKMLE pathway is the same like that. And psychiatry station, ethical station, angry patient, breaking bad news, procedure, we already discussed that. A to E, cement stations.
Yeah, you need to pass 10 and get a qualifying overall mark. And the way you can do this is to also identify some of the high yield scenarios, which will make sure that we simulate and that we bring into your exam. So for these areas that you can see on the screen, these are just one of many. You've got different areas. I think the next slide will show the other ones as well.
Yes, falls, leans, ophthalmology, confusions. These are the few things. And don't leave. And so the basic thing we have already told you. So now coming to our UK Pass Academy, Radwan. So hey, where we are.
We're in Oldham. We're in Oldham, Greater Manchester, Oldham. We are 30 minutes away from the exam venue if you take your tram. And it's very easy to get here, and it's very easy to get to your exam venue as well.
And do we have accommodation?
We do. We do.
Yes.
Yeah.
So we are in the Oldham city center. The tram station is a beautiful area where we are located. And you would be in the Manchester where you need to give your exam. And we offer more than just we talk. We show how it is done. And we will try to cover everything what you need, like accommodation. We'll be doing the we got a very big hall. We'll be showing you from our website different pictures of big hall where we can accommodate 150 students, and we can accommodate 100 students at the same time, can practice on different dummies as well. We got a big so much big practice room as well.